guys, so I decided to do myoclonic epilepsy with red rage fibers, or for shorter would be Merrf. Myoclonic epilepsy with red rage fibers is a disorder characterized by myoclonus, which could often be the first symptom, and it's follow-up from epilepsy, delirium, weakness, exercise intolerance, and dementia. This occurs from childhood to adulthood, and is caused by genetic changes in the mitochondrial DNA, which are found in thousands of cells of the body, particularly in the muscles and in the nerve tissue. Um, it varies about among affected individuals, even among members in the same family. Um, It's characterized by muscle twitches, weaknesses, and progressive stiffness. When these cells of the affected individual are stained in view under a microscope, they usually appear abnormal, and that's what's called rage red fibers. Other features, like mentioned before, are seizures, coordinating movements, loss of sensation in the extremities, and slow deterioration of intellectual function. People with this condition may also develop hearing loss, optic atrophy, which is the nerve cells carry visual information from the eyes into the brain. Some affected individuals may sometimes have short stature and form of heart disease known as cardiomyopathy. Less common people with Merrf develop fatty tumors called lipomas, and those are under the surface of the skin. With recent development in genetic testing, Merrf can be diagnosed on the basis of specific gene mutations, even if rage red fibers are absent. They may not be detected when the child is younger, but they will appear later on within the follow-ups. So this is a case of a boy who's 4 years and 11 months. He was admitted to the hospital. He was reported with myoclonic seizure symptoms. He was born by C-section at 40 weeks, weighing only 4 pounds. He was the only child, and the family had no history of illness. At 6 months of age, the patient was suspected of having hearing impairment, mild hypothonia, and delayed development. The boy wasn't examined by a professional then, but later patient has his first atonic seizure around the 4 years and 8 months of age, and later he developed myoclonic seizures. The time he was admitted, patient weighed 46 pounds, his only height being around 3 feet, and his head circumference of 51 centimeters. Ataxia and poor muscle tone were observed. He also had poor language development and poor articulation, which showed developmental delay. His blood test showed normal. The only thing that showed was lactic acidosis and increase in lactate levels. Electrophenography of the patient showed epileptiform discharges, sharp and wave discharges, but there was no specific findings in the MRIs like shown above. A couple more tests were done and everything seemed normal. The only thing identified was the right sensory of neural hearing loss by using a pure tone audiometry. Merrf syndrome was expected based on the characteristics, clinical symptoms with repeated lactic acidosis. Specific tests were confirmed of mitochondrial etiology. Muscle biopsies were performed from the quadricep muscles, and electron microscopic examinations were conducted. These examinations revealed no rage red fibers. No abnormal findings were revealed. Although an increased number of mitochondria were noted, the myofilament and the electron microscopic examination revealed megaconia, but the characteristic findings of the mitochondrial myopathy were not found. Genetic testing revealed the presence of mitochondrial DNA 88344 gene mutation, and this was over 90%. Mitochondrial DNA from the patient's mother indicated the presence of 75% burden in her blood. So there's no specific treatment. Similar to other disorders, this condition cannot be cured. 1 in every 5,000 person is diagnosed with this disease. Multiple therapies have tried to decrease the progression with variable results such as coenzyme, vitamin B complex supplementations, and L-carnitine. Antiepileptic medications are given for myoclonic seizures and epilepsy. Even though sodium valproate is typically the recommended drug for myoclonic epilepsy, it should be used with caution in mitochondrial diseases as it exhibits liver failure. No head-to-head clinical drug trials are available for the treatment of epilepsy in patients with Merrf, but some doctors do recommend levetiracetam, clonazepam, or sonizumab. Physical therapy and aerobic exercise are also a great help. Other complications, for example, cardiac arrhythmia, deafness, and myopathy, are treated accordingly to the doctor. It is also important to avoid drugs such as alcohol and tobacco. Merrf is a maternal inheritance, and this applies to genes contained in mtDNA. Since egg cells contribute mitochondria to the developing embryo, children can only inherit it from their mother. These disorders can appear in every generation of the family and can affect both males and females, but fathers do not pass the trait, unlike mothers do. So the mother may or may not show symptoms of the disorder. All offspring females with the pathological mtDNA will inherit the pathological variant. The males are not at risk of inheriting the pathological variant. The risk to other family members depends on the genetic status of the mother. If the mother has the mtDNA pathogenic variant, her siblings and mother may also be at risk.